If you've had to go to the ER lately, you know it's not easy. Staffing shortages in many provinces have caused either extremely long wait times or the actual closure of emergency departments. In BC, there have been closures in ERs and acute care centres at hospitals across the province. 4 emergency departments in BC's interior, for example, were forced to close temporarily just last weekend. And when it comes to total hours closed this year, 970 hours of healthcare access have been lost due to hospital closures as of July 16th. That's according to data confirmed by CBC News. Adrian Dix is British Columbia's Minister of Health. Hi, Minister Dix. Good to have you back on our program.
Great to be on the show, Vash.
Minister, there have been nearly 1,000 hours of emergency room or acute care closures in your province this year. That's according to CBC analysis. I know there's one department in Clearwater, BC, that's been closed the equivalent of 15 days in total. Do you think residents in BC have adequate access to emergency care right now?
They do, but we're facing some significant challenges. Really, the vast majority of those closures, as you've reported, have been in 3 communities: Clearwater, which is north of Kamloops, and 2 in the northeast, Mackenzie and Chetwynd, where we've seen significant closures. So we have to take steps, obviously, to address it. What are we dealing with? Well, first of all, COVID-19, both its impact on our system over the last 2 years and its real impact now. As you know, in BC, we have introduced sick leave for workers. And this past week, the statistics for this immediate past week were that 15,775 health workers were out sick for at least one day. Typically, that number is about 8,000 to 10,000. And that has real impact on communities where there are relatively fewer workers, and the safe operation of the emergency room is based on that. So steps are taken sometimes for emergency rooms to go on diversions. We're looking obviously very significantly at the situation in Clearwater because we want to find a permanent solution, not just temporary solutions. But these are real challenges that we're facing right now at this point, both in the pandemic and some of the challenges around healthcare workers that we face in every jurisdiction in Canada and, of course, internationally.
And I do want to focus for a second on, or in a moment rather, on the staffing issue and get some more clarity on that. But just on the initial answer you gave, that you do think that residents in BC have adequate access. I take your point that the closures are limited to certain areas of the province. I'm looking here at the analysis that CBC did: 5 closures in Interior Health, 3 closures in Island Health, 3 in Northern Health, and 1 in Vancouver Coastal Health. That's not nothing. I wonder what, for people who are listening to that and say, okay, I know you're acknowledging there's a problem, but you're saying that there is really adequate access. I think they might scratch their head at that.
No, clearly, if you're in Clearwater, it's a significant issue. If you're in Chetwynd, it's a significant issue in Mackenzie, and there's concern everywhere. We're concerned. What I'm telling you, I think, is that first of all, because of COVID-19, where there's a high level of transmission, and when people are sick with COVID, they stay home. In the areas where we have the highest healthcare workers off sick, by definition, are the areas with the highest transmission of COVID-19. That has a significant impact on the system. We've added in the healthcare system in the last 2 years during a pandemic 30,000 workers, but we're also asking the system to do a lot more. In addition to that, a lot more people are returning to the healthcare system, are in need of care, some of whom have deferred care over the last couple of years. But look, the situation in Clearwater, we're working hard to address, and in Chetwynd, and in Mackenzie, and in the communities in other parts of the province where you're seeing some challenges, Port McNeill and other communities where you're seeing some significant challenges. We're not happy about it. We're working hard to address it. But what I'm saying is that is part of the challenge of where we are in healthcare right now, still in a pandemic, addressing very significant issues and supporting our healthcare systems everywhere. And that's what you're seeing everywhere. Really, whether it's in Europe, whether it's anywhere in Canada, whether it's in the United States, that's what you're seeing here. And we've got to take steps to address the particular problems and build out staffing in the future. We've added, in the last few months, 602 nursing spaces in BC post-secondary institutions. Yesterday, we added more than 300, health sciences spaces. Since I've been Minister of Health, we've added residency spaces for doctors. So we have to deal with a problem that is going to become more significant over the next few years by addressing it now. And that requires ourselves and the federal government to be involved. And you've had that discussion in the last couple of weeks. I won't belabor that. I won't belabor that point, but just say that It's an issue now, and it's going to continue to be an issue. In BC, Vashi, twice as many people over 75 in 12 years, twice as many. And that is the group that uses healthcare services the most by definition. So we need to address health for human resources now to deal with what are serious situations in Clearwater, and we've said it everywhere, but also in the future.
And I don't want to belabor the back and forth with the federal government either, but I do think it's important for people who are watching and have listened to a lot of that back and forth and who are worried about, for example, what you just laid out, right? Like the idea of provinces or the capacity of provinces to retain and recruit the number of staff necessary. When you listed, for example, those positions, the 300 health science positions, in addition, you put out another number you can remind me of it in a second. It wasn't in the neighborhood of 15,000, right? If you're looking at an issue right now where you're having about double the number of people ill a week, healthcare workers, than you're normally seeing, I wonder when you talk about building out that capacity, to what degree it has to be amplified. And if BC, if your government actually can do that. So say the feds do pony up the money that you're hoping they do. Is there any guarantee for British Columbians that you'll actually be able to do with it what you want to?
Well, I think there is. I think there's a will to do that. That these are extremely important jobs, and we have to continue to address the situation. But I'll give you just one small example, because it's a hospital that was on diversion for its ER in Fort St. James, British Columbia. So we're building a new hospital in Fort St. James, and it's a very important community in BC. And they've had a temporary modular hospital since 1972. We're building a new one. Here's the situation in Fort St. James. The number of people over 75 is going to increase by 185% in the next decade. 185% more people over 75. The number of people of working age is actually going to decline. In other words, we have an aging population. And that's why we have to take measures now. That's what we're doing. I don't think we've taken measures in the past that were sufficient over the last 20 years. We have to start to take those measures now. So we have an urgent situation. I take it very seriously what's going on in Clearwater right now, what's going on in Chetwynd and Mackenzie and other communities. What's also going on in larger emergency rooms that are not on diversion, but are facing significant pressures. The health system is under pressure, and we have to address that. But we also have to start to some of the things that we've done recently that are looking 4 or 5 years out, we have to do now, or we're going to be facing a more significant problem in 4 or 5 years. And the federal government has a big role to play in that, right? Because, but it's not the only role, and we have to work together to address these problems. I'm confident we can, though. You know, we had to stand up 1,500 contact tracers in BC in the first and second waves of the pandemic in like a matter of days and weeks, and we did it. We had to set up the largest vaccination campaigns. We're going to have to do it again this fall, right, in BC, and we did it. So these are things that we work together we can do. We're clearly focused on the problems, but there's significant issues in primary care, getting a family doctor. In long-term care, we've significantly increased our investment to improve services, and there is an emergency care. And I think our health workers need to hear that as well, because they are, after 2 years of this, really feeling the pressure.
I think, though, to your initial answer there about how you were at a hospital opening, and I've read criticism from the opposition about the fact that your government is heralding the opening of new infrastructure without adequately being able to staff it. So again, I guess the scale of the problem that you describe, and I'm not in no way disputing that, if the federal government were to contribute in the way that your government hopes that it will, is there the capacity there to actually staff up to the degree needed? Because 300 positions is not 15,000.
Well, absolutely, and I am surprised. I don't want to be too partisan here on a political show, but I'm surprised to hear the opposition. We have hospitals that were built in the 50s and 60s that have outlived their lives, that are a problem in terms of recruitment because healthcare workers want to have top class facilities. Investing in that is one thing you need to do. And investing in health, human resources, and supporting our system now, and putting in efficiency measures. But we have done some exceptional things. In June, amidst all this, and in May, and in April, we set records for the number of surgeries in BC. During the pandemic, we reduced surgical wait lists in BC. We've gone from the worst in the country in terms of MRIs per capita to one of the best. So all of these things have happened, and we've got to continue to do that work. We're asking the healthcare system to do more. And in addition to that, Pesci, and no, it's not the subject of this, but we're dealing with the public health emergency that is the overdose crisis that requires significant investment in health resources. These are the things that we need to do to ensure that we have health systems in place for the coming 10, 15, 20 years, as well as dealing with real pressures and strains that we're feeling right now.
Okay, Minister, I have to leave it there. Thank you very much for your time.
Thank you. Anytime. Take care, eh?
You too. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.